for coming and sharing with the technology. I'm going to be giving just a quick overview of the pilot application process, and then we'll try to leave a lot of time for talking about questions about individual proposals at the end, as well as hearing from our data enclave core, which is a lot of really exciting developments about access to data that we're able to offer pilot awardees. So Dan, Matt, and Frank will be taking over for that. We're once again inviting applications for pilot grants related to the two overarching themes of the Head Center. The first identifies the range of care needs of persons with ADRD and the economic consequences of disease for patients and families. And then the second examines how the organization, financing, and delivery of services affects accessibility, affordability, quality, and equity of ADRD care with both racial disparities and caregiving as cross-cutting areas of interest for our pilots. So this gives us a pretty broad scope that I'm hoping will include your research areas of interest. These grant programs sit in our Head Center pilot core, which wants to provide funding and interdisciplinary research mentorship to kind of help develop this next generation of ADRD research. And so our kind of offer to you guys is that we want to give you both funding to do your research and kind of additional institutional structures that can help make you more successful, whether that's mentorship from the members of the pilot core directly, helping you to find.
Lauren, you're kind of going in and out a little bit. Can you maybe speak up a little bit more?
Yeah, I'm not quite sure what to do. I guess I can try going off video if we think I'm not getting enough internet power.
Yeah, let's try that. See.
Sounds like a microphone issue. Talks closer to the mic.
Yeah, I'm sitting like on top of my computer, even more so now that I don't have to do that on video. So, but if you guys keep having trouble, let me know.
Okay.
So I think as you were talking about, we want to, not only give you the dollars to do some of this pilot research, but help match you up with clinical expertise if necessary, introduce you to other researchers in the field. We have both a scientific advisory board and a translational research board who our pilot awardees typically present to and get feedback from. So we're really trying to kind of invest in these, both in the awardees to help develop your human capital and to help your projects become papers and larger grants and all of the things that help with career development. We're planning to give out about $200,000 total in pilot awards. You can apply for up to $50,000 per grant, and we're kind of hoping that people will apply for the scope of funding that matches their project needs. So we may give out a larger number of smaller grants. For example, if people are in like a postdoc or a fully funded research position and just need some funds for data or conferences, then a smaller grant is totally appropriate. Whereas if you need a lot of instructor time or really expensive data or whatever, then by all means, for this full budget, we're just looking for kind of what it takes to get your project done. We are really excited about supporting junior researchers, and I see some folks who are early in faculty positions, and we're really excited to have you guys here. but we've been supporting folks at a wide range of grants, particularly those who are further along but newer to ADRD research. And we're hoping for kind of a diverse applicant pool. We encourage submission of very informal letters of intent, basically telling us that you plan to apply for a pilot grant and whatever information you have about the nature of your pilot. So it could be like, this is my title and the primary subject is economics, or this is my title and it will be a qualitative research project. That type of information is really helpful for making sure that we are recruiting reviewers who will have the right expertise to appreciate the strength of your proposal. These are not binding in any way. You can say that you want to do a project and totally change what you're proposing. We won't say, you know, why did you change your mind over this span? But if you can give us information about who you need as a reviewer, then that does help get us the right folks in our reviewing pool. We'll have proposals due a month later, so Wednesday, February 1st, and then hopefully announce awards a couple months after that. These projects usually start in the summer once we've had approval from the National Institute on Aging to reduce funds, and so this gives us time to get everyone's IRB documents in place, to get subcontracts put together, and all of that, so that you can kind of hit the ground running when we send you funding. In terms of the content of these proposals, we're looking for studies that use and advance methods in economics and health services research broadly, and studies where the findings will inform efforts to improve the care of persons with ADRD and or mitigate the economic burden of dementia. We're looking for projects that can be feasibly completed in the 1-year period. So we don't need 3 specific aims, each one being like a mini R01 or anything, where we're just looking for something you can do in that 1-year period and that will ideally get you to the next phase in your career. So like if this can be doing the preliminary data analysis that supports a career development award or a first small NIH or foundation grant, then I think that could be entirely within the scope of these pilots. If you have a great idea for a freestanding project you can do in a year, certainly we're really excited about those too, and you know, love to see papers coming out of these grants. Mostly just want to encourage you not to feel like you need to be submitting an R01 level application or kind of doing that work on a small pilot grant. So we've talked about getting these letters of intent done. They're due the beginning of January, but by all means, if you leave the webinar today and you feel like you know what you're going to be asking us for, feel free to send them in at any time. Our actual application materials should be pretty standard. Some required information on the cover page, and then following a general NIH format, your specific aims, significance, innovation, approach, and then how this will help you meet your future goals. And then we'll talk a bit about supplemental materials and budget forms. Grant eligibility is, I think, pretty standard. We need to be able to make the grant is technically given to an institution on your behalf. So typically colleges, universities, and other organizations like think tanks that are eligible to receive federal grants, and you can follow up with Nadia if there's any questions about whether your institution would be eligible. On the principal investigator side, we require folks to have a doctoral degree and either a faculty, research scientist, or postdoc fellow at position at the time of award. So you can be writing this while you're finishing up a PhD and kind of start the award when you start a full-time position. And given the complex nature of ADRD care, we're always excited to see interdisciplinary research teams, and we can kind of help if you don't have those connections already. We can help match you up either if you have questions during the application process, or we'll frequently assign some mentors and guidance to help you once we award you one of these pilot grants. For only postdoctoral fellows, we require a mentor to be included on the application. These are optional for everyone else. And if you're applying with a mentor, we request having their NIH bio sketch or at least a name and email, since not all disciplines do NIH grants, and we're trying to draw from a diverse pool. So for example, if you're in an economics department and you ask a senior faculty member for an NIH bio sketch, they may think you're crazy, and we don't want them to have to create one just for this application or anything. And you can also kind of be in contact with Nadia about any disciplinary questions or conflicts that aren't sort of what you're expecting. And then we'll be basically trying to answer any questions you have with either the pilot process or unique to your research questions. Since we have a small group, we're happy to give any feedback on projects, and we can stop the recording if you don't want anyone or everyone watching this to hear all of the discussion. So I think if there's any kind of clarifying or questions that you want on the recording, you can jump in now before we turn it over to the Data Enclave. Otherwise, we'll open up discussion again at the end, and we'll kind of encourage you guys to reach out to Nadia as questions pop up. She's a great resource and easy to get a hold of.
Thanks, Lauren.
Yep. Okay, so I'm gonna stop the share and yes. Don't see anyone coming off microphone or putting anything in the chat, so maybe we should turn it over to the Data Enclave folks and then take questions at the end.
That sounds good.
Or I would say, if anybody has questions, we're a small group. Feel free to interrupt at any time.
Frank, do you want to take the lead?
Let me share my. Can everybody see my screen fine? Okay, great. Thanks, Lawrence. Thanks, Nadia, and thanks everybody for being here. So let me just highlight the data resources that we make available for our HAT pilot project. And I hope it will be helpful for you in thinking through your research questions and research design. So the HAT Center has been building a remote data enclave to streamline data access. We have restricted CMS data housed on our physical RDEC server. And we are also working to establish data use agreements for survey-linked CMS data to cover HAT-related research. We also have several Hopkins licensed databases that can be linked to Medicare and other claims data. And in addition, some of our HAT colleagues have been doing wonderful work in assembling contextual data on long-term services and supports, and the data will also be made available to our HAT pilot projects. So first, we have CMS claims data. We have Medicare Advantage encounter data and fee-for-service claims data, and also prescription drug claims data. The MA and fee-for-service data are very similar in structure, but the difference is that MA doesn't include payment information, while fee-for-service does. And here we list all the files we have and years, and the years in orange are pending and will be available in the near future. On the MA side, we have 100% outpatient, inpatient, skilled nursing facility, and home health facility claims. And we also have the carrier, which includes professional claims. And one thing to note is that we don't have 100% for carrier as we do in other segments, because the files are really large and CMS won't let us to have the entire file. So we have 12 million MA beneficiaries for each year, and they are the vast majority are part of the random sample. But I would also note that for 2017, 18, and 19, we also include all the dissidents in each year. So it will be very helpful to study end-of-life spending and end-of-life care. And depending on which year it is, the 12 million is from half of MA beneficiaries to 65% of MA beneficiaries. And we also have beneficiary level summary files for all Medicare beneficiaries, which include their age, sex, race, and ethnicity, and plan enrollment. On the fee-for-service side, we have all the 20% claims data for carrier professional services, outpatient, inpatient, and home health. And we also have 20 prescription drug claims for Medicare Advantage prescription drug plan enrollees and standalone plan enrollees. And we also have all the hospice records for Medicare beneficiaries, and have all the state level records for all beneficiaries at the skilled nursing facility and hospital setting. And we are also getting MDPPS AS information, which includes all the individual providers who accept Medicare. And if the data have their specialty information and the locations they practice. And the last piece of the restricted data is home health OASIS file, which is especially relevant to study home health care. And it also includes rich information on patients' living arrangement and also their functional status assessment. And one thing I would really like to highlight is that for all the files I just mentioned, the beneficiaries' IDs in them are compatible across all of them. So if you want to follow beneficiaries over time, you can do that even if they may switch back and forth between Medicare Advantage and traditional Medicare. So that's a big advantage in studying whether patients can switch back and forth when they have diagnosed with a chronic condition as costly as Alzheimer's disease. And also, the second set of data is geo-restricted CMS claims links survey data, and it's not physically on our server, but it's going to be accessed through Magic. But we are working to establish data use agreements with Magic for health-related research projects, and the two survey data are NHAP data and HRS data, which are widely used by researchers working on ADRD projects. And we also have some other Hopkins license data that you can link to claims data. We have provided network data for Medicare Advantage plans, ACA plans, and Medicaid managed care plans. These data have, for each plan, they have all the in-network providers in the data. For example, doctors, hospitals, nurses, dialysis centers, and we also have one key healthcare industry database, which include all the physicians and nurse practitioners and physician assistants and all the organizations they are associated with, such as hospitals, healthcare organizations. And finally, we have the HA survey data, which is historic and present data on all the hospital information. And here's the contextual data that our colleagues are working on. The data will be a platform for studying how long-term services and support environment context shape the experience of individuals living with disability. They are assembling all the data sources at various levels to provide contextual information on people's access and use of long-term services and supports. So these are all the data we have, and will be available for our pilot project. And here's our contact information, and please feel free to reach out if you have any questions. And let me also add that we also hosted a seminar last week with more detailed information on data and access issues, and we'll make that video recording available to all of you. Thanks.
I'll just add that, the reason we're, as you think about pilots, some of the, the amount of data we have can seem a little bit overwhelming if you're new to this area. But, what we're trying to do with heads is create an opportunity to imagine projects at a scope that involve data that you wouldn't typically have access to as someone who's, kind of fairly new to the field. So we understand, and we want to draw people in that have really exciting questions and provide resources, whether those resources are pilot funds or as just reviewed the data. But sometimes it takes a while just to get your head around how to build a question around these data sets. And if you want to just follow up and have some questions, Frank, Matt, and myself are all, would welcome that opportunity. Well, we know that it's quiet because you're busy writing your aims down. um, to, so if there's a, we're welcome to take any questions at any, we have, China.
Hi, thanks so much for this information and for hosting this to provide some clarity. I've been poking around, and I don't know if I missed this at some point in the presentation, but sort of trying to figure out if there are any restrictions to the budget. For example, can I use part of the budget to pay for a research assistant's time or cover my own time? Are there any restrictions at all for what the funds can be used for?
I think kind of standard university disclaimers apply. You definitely can't use them to like buy alcohol for your research team, but you can use them to hire a research team. I think we want to give you guys what you need to do this research generally. So if it's within the scope of what NIA and universities support, then we're happy to see that.
So you can cover your time, you can pay for data, pay for, like if you have study subjects, you can pay for that, pay for your research assistants, pay for travel to a conference to present your work. All that is kind of in scope.
You could pay for someone to help you with data analysis or data cleaning and data management. You may have said that. I may have missed it, but.
Right. And are there, so I understand that you all have all of this data available. Is there a data analyst time that we could purchase to help us sort through some of the data we're interested in using? Maybe we could write that into the grant.
We are working on that. So like, it's not something we can, if you need a data analyst, like ultimately it's kind of on you. Like if it doesn't come through in a way, hopefully as we build capacity, it's something that we can help solve a problem by providing some support, but it's not something we have in place at the moment. So I hope that, it's a little an in-between answer. That's our kind of our aim to be able to provide that, but we couldn't guarantee it. We want to see that the project fall apart because we couldn't make the right match between the skills you need and the skills we have available. Great questions. Does anybody else not like awkward silences?
Just to reiterate the offer that we will at some point turn the recording off. So if people would feel more comfortable asking a question with the recording off, we're happy to do that. But that last question was a great one that would have applied to many people. So I think it was great to have that one on air on the recording. But if you'd like to ask a private question, maybe you can just signal your interest in the chat.